And so the last one, this is a big one. It's got multiple parts. How are cases counted? A lot of people are claiming that the numbers are inflated and that repeated tests of the same positive individual are counted like they're new cases, and that positive antibody tests are being counted as positive cases. Can you clarify how Hardin County specifically counts a positive case?
Yes, and I will clarify too on how Hardin County reports those cases.
Great.
Hardin County, I guess I'll start with cases being counted twice. There is no case that is being counted twice. When a person is positive, their name, their birth date, all of their personal identifying information goes into the system. So if they were tested again with the same name and the same birth date, that's going to show up as that person, and it's only counted once. That one person is one positive case, no matter how many times they're tested. Hardin County is reporting actual positive cases. So these are people who are, and this is what we're reporting on our website. So these are people who have gone in, they maybe have been symptomatic, and they've gone in and been tested by their healthcare provider or another testing site. They are positive. If they're positive, they're tested as our positive cases. So those are what we're calling our confirmed cases. They've been confirmed to be positive. These are not the people who have been tested for antibodies, though. We are not counting positive antibody cases at all. We are not even receiving those reports for Hardin County. The other things that we are reporting on our website are the number of people who have recovered. So those are the number of people who have tested positive and maybe even had symptoms and had elevated temperatures or whatever those symptoms might be, and now they're recovered. So they are no longer symptomatic. We also are counting the confirmed COVID deaths, so the number of deaths that have occurred in Hardin County that have been confirmed to be COVID-related deaths. We are reporting the number of active cases. So what that number is the number of people who are currently positive in Hardin County who have symptoms. Once those people recover, their number goes off of that active cases count. And then we're also reporting the number of current hospitalizations. So the number of people currently in Hardin County who are admitted to a hospital with a COVID diagnosis or who currently have COVID. So those are the things that Hardin County is reporting, and we're trying to do that so that people are aware of these are the actual positive cases. Other sites, and especially the Ohio Department of Health, they are reporting numbers a little bit differently than we are. They are using CDC guidelines as well, and they are reporting presumed or probable cases as well. We are not doing that in Hardin County. What we are, another thing that we are not reporting in Hardin County that you might see on the Ohio Department of Health website are the number of males and females, so gender and age that have reported positive. And we are not doing that in Hardin County, but if people would like that information, they can go to the Ohio Department of Health website.
Good, thank you. I admit that was one of my questions. Like I submitted that question because it has been confusing to see the differences in the numbers.
Yes.
From the state to the county level, and then even looking at like the national level where people are still claiming like the antibody tests are being counted as positive cases. And it's been very confusing.
It is confusing, and it's confusing because everyone's doing it a little bit differently. And I think us at the health department, we've all, talked about, what is less confusing and what is the most straightforward information to give to people, and we believe that's what it is. We don't want to give people that those probable cases, which probable are just like they had symptoms, they've never been tested. We're saying it could be
right,
and we don't want to do that. We want it to give the actual people who have tested positive and that are currently symptomatic or they currently are infected with the coronavirus.
Excellent. Wow. thank you so much for answering these questions. I really appreciate it. And I know that Ada Safe really appreciates it. So thank you.
Thank you for asking me and involving me.